Good afternoon and welcome to Genesee County's monthly COVID update. My name is Shelley Stein and I serve as the chair of Genesee County Legislature. Along with me today is Matt Landers, our county manager, and also our public health director, Paul Pettit. Thank you for joining us today. Our conversations today is going to wrap around really specific items. One of them, our community's responsibility to take vaccine. Without the vaccine, this virus is going to continue to have an opportunity to change and grow into variants. The interrupter there is vaccine. Reopening to our good health and recovery of our economy is specifically tied to that. We also cannot be lax on our face coverings, which are still required when we go into public. So respecting you, respecting your family, and respecting others in the community continues to be extremely important. We want our good health to be your priority too. Let me add a note of condolences to those families who have lost loved ones in this past year. We grieve with you, knowing that we have a spirit and a season of renewal today and in the future to remind us of hope during this pandemic and to recover our health and only then our economy. I'm going to take a moment to thank our volunteers who have been incredible resources for us at our vaccine clinics. Without these amazing helping hands, we would not be to the place that we are currently at with our vaccine clinic capacity, where we run through 1,000 folks a day, which we are grateful for the opportunity to do. But these volunteers are carrying a load at home when they leave their jobs and when they step forward to help us. And those who stand behind in helping those carry that load, they also are providing a great service to us. Nationally, this is the County Government Month, and so an incredible thank you to the leaders in administration and our department heads in our county for the work that you have done over this past year and that you will be continuing to do, providing your leadership. You make all of us very proud, and we know that you are honored to work on behalf of the entire community of Genesee County. With that, Matt, I'll hand this over. Thank you.
Thanks, Shelley. I only have a few notes I want to make before we get into our own Dr. Fauci here, Paul Pettit, our public health director. This press conference is a continuation of our pledge at Genesee County to keep our citizenry informed. We had these a little more frequently previously when we were in the thick of it with a very high level, but we still want to keep our pledge to inform our local citizens of what's going on, everything related to COVID and what we're doing to help fight the battle. We're taking steps here at the county to reach as many people as possible on the vaccine availability. We continue to do this through our social media, through our monthly press conferences, and soon there's going to be a video up on Facebook that we're going to have. So if you follow us on Facebook, please continue to do so. We're going to be putting a step-by-step process and procedure on how to register. We understand that some people find it a little confusing sometimes, a little more challenging. So we're updating with a step-by-step process of exactly how literally the website, the buttons to click, and how you scroll through it. There is actually a new phone number that we are going live with tomorrow. Paul's going to touch on this as well, but it's 815-7168. And there will be a full press release on this, and Paul will touch on it as well. This phone number is important. We've determined that some people don't have internet capability, or they're just not savvy, and we're trying to make it as easy as possible. So what this will provide is that we'll have a dedicated person available to answer questions related to registering for the vaccine, and actually can help you register directly online. So this is going to be a big help. We know Orleans County is doing the exact same thing. And so this is an initiative that luckily we have some assistance from our county department heads and Paul Pettit to make this happen. And when possible, from time to time, there will be opportunities for walk-ins. I know that's not the preferred method because we have pre-registering as the ideal, so we make sure we have enough vaccine. But even as recently as yesterday, there was an opportunity to accept some walk-ins. So we quickly, as a county, turn around and put the message out through social media, through print, through handing out flyers at food banks to try to drum up and make it known that there is a walk-up clinic opportunity. So those are examples of Genesee County trying to reach people in all possible ways to help get the vaccine word out there. We need, as Shelley said, we need our residents to step up and get vaccinated. If we have any hope to get back to the old normal, where we can enjoy festivals, parades, concerts, sporting events, then we need to all do our part to step up and get this vaccine. We also should be thinking of our local businesses, as there's still very troubling restrictions that are being put on our businesses because of we haven't reached herd immunity at this point in time. So between wanting to get back to the old normal and to help our local businesses, I please urge you to get the vaccine. Paul's going to again touch on this a little more as well. I'm sorry for stealing your thunder a little bit, Paul, but there's going to be some Pfizer available for the upcoming week. This is very this is good news, as this is something that our 16 and 17-year-olds can take. Speaking as the father of a high school student and who plays spring sports, one way that I hope parents and their teens look at this as an opportunity to hopefully avoid unnecessary quarantining later in the spring sports season. There's also a lot of end-of-year activities that high school students are going to be having coming up that if they could avoid a mandatory quarantine because they've been vaccinated, that should be an appealing incentive to go get the vaccine as well. So hopefully that is something that entices people to get the vaccine. And lastly, we are accepting volunteers as always for our vaccine clinics. We've had a great outpouring. It's very heartwarming. One of the silver linings in this whole process has been seeing the huge amount of people that have stepped up from the community and our own county workers that have been reassigned voluntarily to go over and help out. I can't thank the volunteers enough for all the hard work. And Shelley, you do a great job of plugging and thanking everyone else. I'm going to thank you because Shelley is there quite often. She was there at almost all of our testing clinics, and now you can see her at most of our volunteering vaccination clinics. And that volunteerism is definitely alive and well in our chair of the legislature. And Shelley, you do a lot of thanking other people, and you don't get enough thanks yourself. So thank you for all of you, your efforts in stepping up to volunteer. That's been very great to see. And your colleagues as well. I've seen several legislators that are there quite often. So that's enough of me talking. I'm going to turn it over to our Dr. Fauci here, Paul Pettit, who will be able to give us some very insightful updates.
All right. Good afternoon, everybody. Thank you, Matt, as always. Again, you covered a lot of different things, so you'll make my section a little bit shorter. And I'll echo your sentiments and thanks, Shelley. You're definitely leading by example as the chair of the legislature. And, it's I think very telling when you have, your chair out there working at all of our clinics, really. We see you there very often, and not just you, other legislators, other department heads. And it's really a group effort. And we're very pleased in Genesee County and Orleans County, and in the data I'm going to run through, I'll be covering data for both counties, for the efforts that have come forward from those wanting to help out our communities. And, again, I'm going to thank our staff. We just came off a public health week last week, an opportunity to just look at what public health means to our communities and the different roles that we play and how we, work towards preventing disease and promoting health within our communities. And obviously, we spent the last year plus now dealing with COVID, and we're still in the heat of that battle. But I do want to recognize my staff who continue to deal with contact tracing, who offer testing over here at the health department, who are at the vaccination sites, that are working with our communities and our businesses around reopening plans and how do we get things back to some sense of normalcy. A lot of phone calls, a lot of interaction and engagement with the public. And, I'm very proud of the work they do for our residents in both Genesee and Orleans County. So I'm going to run through some data like I usually do and kind of update it on a few things. And obviously we have our press here, so I want to make sure there's opportunity to ask questions and we can try to get you the answers. And if we don't have them, we'll get back to you with them. But, you know, as I start off, I want to look at data, you know, so just where we are currently with COVID in our communities. And, you know, obviously we have seen an upward trend over the last month or so. You know, the data has clearly shown that we are seeing more positives. You know, we've looked at the data a little bit here, and it's clearly, and this isn't just locally here, but even in the Finger Lakes region and beyond, that, you know, we are seeing a higher percentage of positive cases in our younger population. And you know, I want to say this is obviously to be expected, right? So we haven't really had the vaccine out yet for our younger kids, and when I say younger, that could be up to 30, 40 years old. You know, I'm still trying to get in that category myself here, so. But beyond that, you know, when you look at it, we've focused on vaccinating our seniors, right? Those are most vulnerable, those with underlying health conditions. And as those numbers continue to climb and we get higher percentages, we're just now only a little over a week into vaccinating anybody that wants the vaccine that's age eligible. So it's not a surprise that we're seeing higher numbers in some of those age groups because they haven't had access to the vaccine yet. Now that is changing with that opening up. So we're hoping that we'll get a higher number of those folks wanting to come in and get vaccinated. But you know, here locally, we did pull a little bit of the numbers. Around 56% of our cases in Genesee and Orleans County are in their 40s or under. And this is in the last month or so. 72% are in their 50s or under. So again, if you're looking at age group wise, you know, we are getting a higher percentage in our you know, mid to younger age groups. The other thing that the data is showing is we are seeing, you know, again, some cases in our congregate settings over the last few weeks, and that includes, you know, jails, prisons, still nursing home residents are still coming back positive. So, you know, between the younger age groups and some of these congregate settings, that's really what's driving many of our numbers, you know, over the last month or so since we've talked last. And when we look at those younger age groups, you know, the data is clearly showing that the transmission is really occurring in social gatherings, family type settings, you know, where people are getting together, friends are getting together on the weekends or the evenings for, you know, bonfires, birthday parties, different types of events. We've seen many different types in these case investigations. And those are really where the primary source of exposure is coming from due to those more of the social interactions. We're still not seeing a lot in businesses. We're not seeing a lot in a lot of scenarios where, again, masking and distancing is required because, again, those mitigation strategies have shown to be effective in those settings. It's typically, again, when we get into these social settings where, again, there may be less of those mitigation strategies occurring. All right, so looking at the numbers, again, Finger Lakes side, which is where we lie in Genesee and Orleans County. And again, I'm going to juxtapose kind of our current numbers to last month when we talked, so you can see a little bit how the trend's been going up. A month ago when we chatted, we had 182 positives per day on the 7-day rolling average. As of yesterday, we're up to 376 positives per day. So again, showing that upward trend. If you look at the positivity rate on the 7-day, we're at 1.6, we're up to 3.09. If you look at the 14-day, we're at 1.64 and we are up to 2.9%. Again, this is in the Finger Lakes region for overall positivity. And hospitalizations is another area we continue to watch. I mean, luckily, again, looking backwards towards the holidays when we were really concerned with bed capacity, we don't really want, obviously, anyone in the hospital or in the ICU, but our capacity in the region is doing well at the moment. But currently, we do have 181 in the hospital and 48 in the ICU with COVID. Again, hopefully, we can continue to see that number go down. But there is plenty of available capacity compared to where we were several months ago. Delving a little closer, looking at Genesee County, number-wise positivity, again, last month we were at 2.4% on the 7-day. We are now at 3.2% on the 14, 2.3, now at 3.5. So again, showing that increase. If you look at total numbers across the line, we're at 4,876 positive cases of COVID since we started tracking, 115,800 negatives. We currently have 83 active cases with 4 folks in the hospital. and 4,267 have officially recovered. And if you look at Orleans County, again, last month, 7-day 1.7. Currently, the 7 days at 3% positivity. Looking at the 14-day, we're at 1.8% and currently at 3.5%. So again, our numbers locally are right on par with where we are in the region. But again, it reflects that upward trend. Reading the line for Orleans, 2,692 positives, 62,604 negatives, 60 active cases with currently 4 in the hospital, and 2,239 have recovered. I do just want to note again for our folks in the press, we do put out a daily press briefing that comes out around 4 o'clock every day, give or take a little bit of time. Depends on how quickly we can pull the data together. Again, our charge and our goal every day since we started this pandemic over a year ago has been to provide local, actual, factual data, right? As real time as we can, and we continue to make that a charge and a goal of ours. So we do put out that briefing every day around 4 o'clock, Monday through Friday, with all the updated information, the data, links to all the different guidance documents, and any relevant local information. So I would encourage folks to continue to refer to that. You can find those briefings on our website also, and be able to look back those if you need to. All right, shifting gears a little bit guidance-wise. I'm not going to read through all the different guidance updates. Obviously, this is kind of a rapid evolving situation. We again continue to see changes coming daily, every other day when the governor gives his press conferences. There's usually some new changes that come along with that. We are doing our best to digest and regurgitate that back to you. It's not always that easy, as these guidance documents often lag when it comes to the announcement. So these announcements come, and then the guidance that goes along with that may be several days or weeks later. And obviously our goal is to try to help our community residents and business decipher and interpret exactly what this means. So we do our best with that. And obviously we do push all that during our daily briefings. But I would encourage folks to continue to reference Forward New York. That is really where all this guidance documents, all the information that folks need to come and identify with is really posted. So I'd encourage people to continue to watch that and stay in tune with that link, in addition to obviously what's reported out by you guys in the media and what we put out locally through our daily health briefings. Obviously, last night was announced there that bars can stay open till midnight. Catered events and weddings can continue till 1 a.m. So again, that time period continues to slow walk forward, or I guess backwards, however you want to look at it. But ultimately, there is additional time that the governor is allowing those type of events to stay open till. So I know that's welcome for a lot of these venues to continue to get greater relief. I know more is sought, so hopefully additional announcements will be coming soon. Large gatherings, so there was just a lot of information put out about end of the year, academic celebrations, graduations, proms, different things like that. So again, there's a lot of information that will be coming out on the details of those. I know the schools are currently looking at a lot of that information as they plan for their end of year celebrations and activities. Obviously there are testing requirements or proof of full vaccination requirements for a lot of these different events. So it's important, if you are the responsible party, the venue or the host of these different things, to make sure that you're up to date with the most current guidance. And again, there's a lot of links out there, and I know I have Nola, my PIO, popping in some different links in the chat. And again, we do put these in our press briefing for reference for folks if they're looking for it. Another thing with the notification, a lot of them require the responsible party to notify the health department of when you're having these different events. So we do have a link on our website and that we will be posting here that, again, if you are one of these venues, make sure you are letting us know. We are not reviewing plans. We are not approving plans, but we are receiving the notification. We are doing the minimum there of what the guidelines require on that. So make sure you do notify us. And again, that link is there. It's going to ask you for some basic information on the event, dates, number of folks coming, those type of things. But I would encourage, you to let us know of those as soon as you're ready to plan your event. Non-essential gatherings, obviously those limits have been increased again. Indoor, we're up to 100. You can go up to 150 with proof of testing or proof of fully vaccination status. For outdoors, it's up to 200 without testing or vaccination, or up to 500 again if all the attendees show proof of a negative test or obviously fully vaccinated status. Private residential gatherings are still at 10 indoors and 25 for outdoors. All right, so again, there's guidance out there for events, arts, and entertainment. There's guidance out there for sports and other types of venues and events that have just come out for large gathering, races, et cetera. So I'm just going to refer folks to Forward New York for those updated guidance. Again, I'm not going to take the time to walk through all that. If you do have questions, feel free to reach out. We'll do our best again to help people understand that as best as we know, and work through that so everybody's as compliant as we can be with the current guidelines. The other big note before I move on is just with the changes on travel. Again, international travel has now been amended to complement exactly what happened with domestic travel recently. You no longer have to test out or quarantine if you're coming back. So again, I'd refer you to the updated travel guidance that's available on the state website. All right, so real quick, schools is another area that has had a lot of attention lately. So we have been working with our school districts in both counties regularly throughout this pandemic, but more specifically, we've had a lot of conversations in the last week. As everyone is well aware now, the State Department of Health dropped the new updated school guidance at close to 5 o'clock last Friday, which obviously was something that the schools have been asking for several weeks and going on a month since the CDC announced their updated school guidance. And again, the goal was moving towards increased in-person learning. The 3-foot distancing was the big golden nugget that a lot of folks were asking for. That was included in the new update that the state adopted from the CDC. There are a lot of things in the guidance, though, that has created some confusion and concerns by schools. The guidance that has been adopted has taken away some current practices and approaches that schools have been using since the start of school back in September. And this has obviously created some concern and some frustration in several of our school districts. And we've been working through these different changes with them. We have been having a lot of calls with the State Department of Health and state education, the chamber around these different guidance and what it means, looking for clarification and continuing to advocate for our local schools to make sure that they can get back to as much in-person learning that they can do as safely as possible in line with the guidelines. Just a couple real things real quick on this. Some of the biggest changes are masks are fully required now 100% of the time. In the classroom setting, even when the students are seated. That is a change. In the original guidance, there was some autonomy allowed for the school districts to, again, engage their community, engage their stakeholders, and the ones, there's several that obviously have not been wearing masks once the students are seated and more than 6 feet apart. That is a change, and currently with conversations with the state, they're not going to waive on that. That is a new requirement that is in the new updated guidance. The other scenario that we've had is around these plexiglass barriers that have been utilized in some of these schools since the beginning of the year. Again, in the original guidance, those were allowable as a potential mitigation strategy to reduce densities, and especially in the cafeteria settings. When obviously face masks are taken off while folks are eating. The CDC and now the state no longer recognize those as a mitigation strategy, which is creating some logistics challenges for our schools that now have to look to how to move students further apart, especially in the cafeteria settings where they, again, have been operating all year under a different approach. Obviously, the other big piece of this is to get down to the 3 feet. The CDC has a community transmission schedule that they set up with 4 different levels based upon community positivity rates or per 100,000 rates over a 7-day average. Again, if looking at what the CDC has and looking at our local data, we currently are in red, the red transmission, which is the highest in both Genesee and Orleans County. And that creates another problem again, in particular the middle school and high school settings. When you are in a red zone, red level, you are not allowed to have high school and middle school students at 3 feet or less than 6 feet, unless you're able to cohort those groups, which again, talking with our school districts, it's a big challenge when you get into the middle and high school levels, because again, they typically move class to class to class, not like in elementary where they have a classroom where they typically stay there all day long. So currently it's a bit of a challenge, when you are in the red zone, to be able to get down to 3 feet in the middle and high school. Elementary are allowed to go down to 3 feet even in the red zone, again, due to the cohorting approach. So, bottom line, our schools are responding to this new guidance, obviously engaging with their boards, engaging with their community, and having a regular dialogue with us. Obviously we're working with them to get them in compliance with the regs as quickly as possible. But again, there are some tweaks and changes that are going to have to occur in some of these districts as we move forward. But ultimately, again, each school is responsible for making sure their plans are in line with the guidance that has been put forth by the state, and we'll continue to work with them locally to get them there. All right, real quick on testing. So we do offer testing at both local health departments. I think, as I mentioned last month, we are in the process of transitioning from our bigger drive-through or drive-up testing operations and emergency management over to the health department. Demand for these continues to be fairly low, and this again is asymptomatic testing, rapid tests. So we have moved that over to both health departments. So we currently test 2 days a week. At least over in Genesee County, and at least 2 days a week over in Orleans County at our health departments. I think NOLA just put up the link for that. Again, that can be also reached by going to our websites. But we do have limited appointments. We try to get up to potentially 100 per week. And this is, again, asymptomatic testing, and we'll continue to do that as long as we have testing supplies and the demand is there. But I'd encourage folks that are seeking that out to go on and register each week, and we'll get you taken care of. All right, moving to vaccination. So as Matt and Shelley were mentioned, we are making progress. Our numbers continue to go up, but we still lag behind both the state and the Finger Lakes region as a whole in Genesee and Orleans County. We're at a point now where we've transitioned from really, you may have heard us over the last several months saying we need more vaccine, we can't, we don't have enough to meet the demand. Well, it seems like kind of overnight we've transitioned from that situation to now we have vaccine and we need people to sign up, right? So unfortunately, this is not a unique situation here in Genesee or Orleans County. Pretty much everywhere around the state, particularly in the rural areas, we've kind of hit a transition point where the vaccine now is starting to flow, and we have plenty of available appointments, but we're having trouble filling those appointments. So this is the first week where in both Genesee and Orleans County, we have not filled our Moderna clinics. We had, availability of up to 900 up in Orleans County on Monday. We only ended up vaccinating about 650. On Wednesday down here in Genesee, we had 1,000 doses available, and we ended up vaccinating just a little over 400. Again, we have clinics set up for tomorrow up in Ridgeway, and then again on Friday. So we have vaccine. So we talked a lot about frustrations with, having to travel and go find vaccine in the cities and other counties. And at this point, I want to, just articulate to our residents that the vaccine is here. And we have it locally. You don't have to travel far. You can get it within your county. Again, we promote both of our testing sites for both of our county residents. So whether you'd like to go up to Ridgeway or you want to come to GCC, we're happy to take care of you in either location. But now's the time, right? We have the vaccine, we have the appointments. We'd really encourage you to take that step, call up, go online, make that registration, and get in and get vaccinated. So as we look through this, currently, as everybody's aware, everyone 16 and older with the Pfizer vaccine is eligible. Everyone 18 and older with Moderna and Johnson & Johnson, at the moment, not with it on pause, but when it gets unpaused here, hopefully, we'll be able we can vaccinate with those vaccines. We are working on getting the Pfizer vaccine. We are hoping to get a small amount. I believe we have that secured, so we'll be getting that. Again, and we're thankful to Monroe County for sharing a little bit of their Pfizer with us. But we are going to be targeting 16 and 17-year-olds with that small allocation we're getting next week. We're going to be working directly with the school districts to get folks signed up. And as Matt mentioned, here's an opportunity to get vaccinated. So these sports activities, end of year proms and different types of events that folks want to attend, getting vaccinated is a great way to make sure you can attend those and not be quarantined. That's the last thing you want to do is miss out because you're stuck at home on quarantine. So get vaccinated. We will be reaching out to the schools. So, they'll be getting that information out to their families to let them know of the availability next week. And we'll continue to push for that moving forward and make sure we can, again, bring some of that locally to our residents. Currently, Pfizer is elusive and hard to get. The state has been clear that over the next couple of weeks, don't expect to be able to get much of it, if at all, any in the county level. The state sites are running Pfizer. So again, if you're able to sign up for one of the state sites, we have many of them around. Unfortunately, not one at GCC, but there are several in Monroe County, Erie County, Niagara County has one. There's one down in Corning. All of these sites are running Pfizer. So again, if you have 16 or 17-year-olds and you're interested in getting them vaccinated, I would encourage you to go on their site and look at those different locations. I do believe they're also in a scenario where they do have available appointments showing. So look for it that way, and we will push it out locally when we get it. So again, we've had issues, over time getting people registered. We had a great collaboration going with our Office for the Aging for our seniors several months ago with helping folks get registered. And as Matt mentioned, we're pleased to announce that working with, internally with county departments, DSS in both counties, we've been able to secure an opportunity for folks that are having trouble maneuvering through the website, whether it's just difficulty with that, maybe they don't have internet connection at home, broadband issues. We've talked about this many times. We are going to have phone numbers, right? That, no matter where you are in either county, you can call either one of these. And they will help you get registered. So we're happy to make that available. We're hoping to remove and reduce barriers to access to this vaccine. And we're hopeful that this will be a way that we can do that. So again, starting tomorrow, we will have these local numbers available in Genesee County. As Matt mentioned, the number's 815-7168. And in Orleans County, the number is 589-3170. So again, if you're looking for assistance with registering and you can't get on the internet and register yourself for whatever the reason may be, please feel free to call those numbers. We're going to have them widely available and promoted through social media. We'll have them in our daily press briefings. So feel free to, to monitor and call if you need the help. That's what it's there for. Also, we're going to be working a lot closer as we're, again, starting to see that demand at our mass vaccination sites with our local businesses. Trying to potentially even take the show on the road in some areas to go potentially offer vaccine at these larger businesses in our communities. This is similar to the pop-up pod model that you've seen in some of the larger counties occurring, where we can go out and try to offer this in different areas, and try to get to different corners of our community, essentially taking vaccine to the people. And obviously we're going to be looking at many different strategies as we move forward and how to make sure that everybody that wants the vaccine has access to it. And that's really the goal here, whether it's through a county site, whether it's through a pharmacy, through your provider, any of the locations are good to go get it. We just need you to sign up. We've also been working hard with our growers in both communities to try to get our farm workers vaccinated. Obviously, the governor talked about that earlier this week as an initiative to, try to push that and get as many done as possible. That has been underway discussions for a long time, but actually in process now. Unfortunately, we were really using Johnson & Johnson as the primary vaccine in those settings, and we're on pause at the moment, but we continue to have our plan fleshed out and we're ready to go. We just we'll continue to move forward as able. All right, so I'm going to run through some data real quick just to provide some updates on where we are vaccination wise for everybody. But again, I would encourage people to visit the vaccine tracker page. So New York State has a vaccine tracker website, which has a lot of information on there. It has daily percentages. It gets updated usually once a day, and it shows where every county is with percent vaccinated compared to the state, compared to the region. So there's a lot of information on there that is available for folks to view as frequently as they would like. But real quick, looking at vaccination statistics, New York State's about 7.8 million vaccinated with at least one dose. That's about 39.1%. About 5.1 million with the completed series. So that's either 2 shots of the Moderna or 2 shots of the Pfizer or 1 of the Johnson & Johnson. That's about 25.9% of the population is considered fully vaccinated at this point. Drilling down again into our region, the Finger Lakes, we're at about 491,000 with at least 1 dose, or 40.8% of the population. 342,000 with the completed series, or about 28.4% are fully vaccinated in the Finger Lakes region. And drilling down into our local counties, Genesee is up over the 20,000 mark. So we're happy to see that. We're at 20,421 with at least 1 dose. Again, around 35.5% of the population. And we are at 13,704 fully vaccinated, or around 24%. Orleans County, we are at 11,625 with at least 1 dose, or again, 28.6%, and 7,848 with the completed series, or 19.3%. So, as you can see, we have a little bit of work to do in both counties. We are behind the percentages of where we want to be comparative to the state and comparative to the rest of those in our region. So again, putting that plea out there and that strong encouragement by folks to go out and get vaccinated. It is important for yourself, for your loved ones, and making sure, again, we can continue to move forward towards some normalcy and some of the old way we used to have things. So we need to keep pushing forward with that. And again, just a quick reminder, think before you register for the Pfizer or Moderna vaccine. We want to make sure that you can come back for the second vaccination appointment. That is a continued challenge where we are getting a lot of cancellations and people looking for second doses or canceling. So just a reminder, when you do register, just make sure you can commit to that 4 weeks later for Moderna or 3 weeks later for Pfizer. Just real quick on the Johnson & Johnson, obviously that's well in the news. We're still waiting to hear if that's going to be unpaused. Again, the issues that they've had with that are very, very, very rare. The vaccine is still considered very, very safe. They just want to, obviously, out of an abundance of caution with a new emergency use vaccine, make sure that they're looking at the data before they unpause that and hopefully get us back to using that in our communities. We are following that closely, and as soon as we get the green light on that again, we're hoping that to be able to get some additional supplies in to make sure we can get that out to our residents that are seeking the Johnson & Johnson vaccine. Again, it's been very helpful in the ideal vaccine when we're working with certain populations where it's easier in ensuring just at least 1 vaccination and then they're fully vaccinated. But again, no definitive timetable on that. But in lieu of that, again, strongly encouraging folks, take the Pfizer, take the Moderna. We do have that available, the Moderna particularly. Spots are available, and we want to make sure you can get that done as soon as you want here locally in our communities. All right, so with that, I am going to turn it over to questions as we typically do at these events. Just make sure if you have questions, you state your name and what affiliation you have, and we'll be happy to answer any questions. It could be for myself, for Matt, for Shelley. And if we do not have the answer, we will be taking note of the question and we will be sure to get that back to you as quickly as we can. So with that, I will turn it over for questions.
Hey, Paul, Howard Owens from Batavian. How you doing?
Hey, I'm good. How are you?
Good. Hey, so related to the rate of vaccinations and the fact that there was a surge in demand and now that seems to be waning, and at 20-30%, we're nowhere near what's epidemiologists say we need to be at for like herd immunity, which you hear numbers 60, 70, 80%. How concerned are you that we're not going to get there, and what that means for quote unquote getting back to normal?
Yeah, I mean, it is a concern, right? I was not expecting us necessarily to stall out, and I'm not as we're fully stalled, but at least to slow down as quickly as we did. I mean, we've ramped up these vaccination clinics to be able to vaccinate thousands a day, as you guys are all well aware. And, we're finally to the point where we have the vaccine to actually do thousands a day, and we can't find the people to come in and take the vaccine. So, it's kind of that, oh, we're all dressed up and no one's showing up to the party, right? Type of analogy. So it is a concern. That's why we're really pushing it hard. Matt did a very good job articulating why it's important, in our communities, especially if you look at getting people back into restaurants and to businesses and, different restrictions that have been put in place. We know that the governor and the state are going to tie this to vaccination rates. And the quicker and the sooner that we can get folks vaccinated and get up to a higher level and percentage of our folks vaccinated, I believe that the sooner we're going to have that opportunity and we're going to see some of those restrictions lift for us. So it is a concern. I do believe that, with continued pushing and taking the show on the road, offering, phone numbers and different ways to register, we're hopeful that those pull down some of those barriers and allow for easier access to making appointments and getting signed up. But we do have a ways to go. Obviously, with only 35.5% of our residents in Genesee County with their first shot anyways. We need to get up higher. And with the vaccine just opening up to everybody now, again, age eligible, we're hoping that that number will start climbing. And all we can do is really encourage and talk about the benefits of getting vaccinated. And obviously, first and foremost, you can prevent yourself from getting COVID. If you do, it would reduce the symptoms, but also it keeps people out of the hospital and, from unfortunately sometimes passing from COVID. And we still have, a percentage of seniors and percentage of those with underlying health conditions in our community that have not been protected yet. So again, if you're a younger person, you may weather COVID fine asymptomatically or with very little symptoms. That doesn't mean that you're still not susceptible to taking that home and taking it to grandma and grandpa or taking it to someone else that maybe has not received the vaccine yet. So there are benefits, and there is obviously other things of getting into sporting events, getting into weddings and other type of events where if you can show your full proof of vaccination, you don't have to go through the testing process and potentially pay for testing. You can attend those with proof of full vaccination. So we're going to keep talking about the benefits, talking about the positives of why it's important to get vaccinated. And ultimately, we just need community support and encouraging neighbors, friends, and family to sign up. Again, we have the availability.
Is there, are you tracking, and is there any issue? Is there any issue with people not getting their second shot?
So overall, not at the moment. It has been a bit of a challenge, again, particularly when we had a difficulty with the numbers of vaccine available, but now with having some additional supply, we are getting, I think, that kind of backlog of people looking for their second shot figured out. You got to remember, we've had a lot of folks coming back from out of state. They maybe were snowbirds or coming back from other areas. They got their initial vaccine somewhere else, and they're coming back saying, hey, I need to get my second shot. So we are working on getting folks in and getting them taken care of with the second dose. Obviously, we want to get people fully vaccinated if they're using the Moderna or the Pfizer, so that includes both shots.
Last question.
Yep.
In talking to, and just I'm just hearing a lot of chatter about with some school districts are not going to be doing some of their normal functions, whatnot, and there's parents groups popping up, organizing events, and of course, graduation season. There's always graduation parties and everything. We're coming into that season now. Any concern about in the current environment, those private gatherings? Last summer there were a lot of private gatherings. We didn't see much spread, but maybe we're having more. COVID kind of has a greater head start coming into this summer season. So any concerns there?
Well, yeah, I think, we have to have, some balance here, right? I mean, obviously there are guidelines that speak to a lot of these different events. And, we obviously are encouraging folks to follow those guidelines. But this is another great example of get vaccinated, right? So if you're attending these parties and going to these different events, if you're vaccinated, again, high likelihood you're not going to get COVID. And if you do, again, you're going to have a much a milder or asymptomatic experience, and you're not going to spread it to others. So, the more that we can, encourage folks to get vaccinated, and again, as we get into the summer season here and those events that you're talking about, and If you're vaccinated and protected, that's where we want people to be. The best thing we can do is continue to encourage that. Obviously, with what we're seeing with our numbers, a lot of it's getting tied back to these type of social events. So remember to keep your distance, make sure that you're, hand washing, you're wearing masks if you need to, in those type of settings. And that's the best thing we can do is encourage that. But we'll see what the numbers do. Obviously, we've seen little jumps and spikes after holidays and after other events, and we're not quite sure what COVID is going to look like this summer. But the more we can get people vaccinated, hopefully the better the outlook on things.
Great.
Paul, Jen Lukey here from News 10 NBC. I wanted to circle back to schools for a moment. The state essentially dropped this guidance and said, okay, counties, you're in charge of enforcing it. What will enforcement look like for you? For example, if your school districts are open with plastic barriers right now, will you ask them to close if they can't meet that distancing rule?
Yeah, so I'll back up to your first comment. Yeah, this was dropped on us and there was no warning or heads up that look at we're the state, we're washing our hands of it. Locals, you deal with it. I guess this isn't the first time we've seen that, or probably the last. And again, 4 or 5 o'clock on a Friday. But with that being said, the reality is, yeah, they have put the charge on the local health departments for compliance. Now, in line with that, we are not required to accept, as far as review plans, approved plans. So we are not going to be doing that. I've already told our superintendents that we are not getting into that business. We don't have the capacity or the bandwidth, the wherewithal to be doing that. But when it comes to compliance, again, the guidance is out there. The school districts are responsible to meet the guidelines. My thought here and what we're planning to do with the schools is to work with them. Some of them already have these different barriers in place. So, there's going to be a transition time as we work towards getting them compliant. The state, again, did not really provide any clarification on the process, the timetable, what enforcement, what that looks like. And our job here is to work collaboratively with our schools. We're not looking to be heavy-handed. We're not looking to close them down. We want kids back in learning. We want them in a safe environment that allows them to succeed and do well. So I'm planning to work with our schools locally to make sure we can get there.
Yeah, and just one follow-up on the transmission rate question. We saw Leroy put out a notice today to parents just saying, hey, we're going to go next week and then we're going to see where the rate goes. The guidance doesn't really get into like week to week. 1 week you may be red, 1 week you may be yellow, 1 week you may be blue. So, are you just looking for them to not be red to start? And then is there any way for them to stay open after that if the numbers keep fluctuating?
Yeah, so those are all great questions. So we've asked the state all those same questions on several calls, and we're getting not overly clear answers, to say the least. So, that's our concern, right? So it doesn't really identify in there what data set, what point of reference do we use for the data. Obviously, the CDC has theirs. The state has some on their website with the data page that doesn't necessarily line up with the CDC. We could run local data ourselves that would show that could be mainly be in conflict with some of those. So we're trying to get some clarification on that. In the meantime, we're asking the schools to look at the guidance and start to move towards being compliant with the guidance, because ultimately, again, it's their responsibility to fall under whatever the state has put forth in this updated guidance. But we are looking at how we interpret the guidance in the community transmission rate. Again, what's the time period? Because as you said, it could change literally. If you're hovering on that 100 per 100,000, you literally, one could be red and then orange, and that has huge implications, right, for what a school is allowed to do. If you're in the red transmission zone, as I explained earlier, you really can't bring your middle school and high school kids back if you can't cohort them. If you go to orange, you can. We strongly recommend you cohort them, but you don't necessarily have to. So there are big implications in here when you're playing around with a number from 99 to 101 per 100,000. So again, my desire here is to work and be as flexible as we're allowed to be locally. The goal is to get these students back in the classroom in a very safe and effective learning environment. And we're going to do whatever we can to advocate and push back to the state and get clarification to make sure we can, again, have that happen locally.
Thank you.
Yep.
Paul, I don't hear any more questions, so I would encourage us to wrap up. Any final thoughts, Matt?
No, I appreciate, excuse me, I appreciate the media helping us deliver the message to our citizens and Western New Yorkers. So again, we will continue to do this on a monthly basis. We'll schedule a one probably for the middle of May, and hopefully we'll have some better numbers to report at that point. And I thank Paul and Shelley for everything you're doing. And I look forward to continuing on this path to getting hopefully vaccinated and back to normal.
Thanks, Matt. Thanks so much, Paul. And I would say to those that are joining us today that after listening closely, if you have determined that what you've heard has encouraged you to take the vaccine and to make that appointment, please know that you can do that by calling that number, 815, gotta make sure I get this right, 815-8176, and we will happy to help you register. Again, 815-81, I didn't say that right, did I?
It's 815-7168.
There you go. Thank you very much, because it's important, folks, that we do this for each other. Thank you, everyone. Have a nice afternoon.